This is Dr. Chris Robertson. I'm going to provide an overview of our week 1 content, which focuses on the DNP prepared nurse, research translation, and the DNP proposal. We live in a time where we have a very complex healthcare system. That healthcare system requires certain core competencies in healthcare providers in order for us to solve some of the many issues and concerns within the healthcare system, particularly those that impact patient populations and patient care and service delivery. And so it's created opportunity for DNP prepared nurses. DNP prepared nurses have certain skills and competencies that respond to the issues and address the issues within the complex healthcare system. One of those skill sets has to do with research translation. And so we will go into a little bit about what exactly is research translation. And as a DNP student, your DNP project serves as your opportunity in your course to be in DNP prepared to implement that skill, develop that skill of research translation through your project and make a difference in population outcome and change a system. So here's this complex healthcare system. We have more people to manage, more things to monitor and watch for, and just overall more people involved. In many circumstances, obviously, that healthcare system is uncoordinated and is poorly organized. And the reality is it doesn't always provide high quality care consistently to all people, which goes back to the concepts of health disparity. Alongside this complexity, you have an environment where science and technology are advancing, and healthcare needs overall have just changed. People are living longer. There's an increase in chronic condition. And so given all of these changes that are occurring dynamically at the same time, our nation's healthcare delivery system has fallen short in its ability to translate knowledge into practice. So we have this science, we have this technology that is advanced, but yet we still have all of this uncoordinated and this poor organization, and we still have all of this disparity. It doesn't seem that one would exist with the other. It seems that one would help solve the other. So what's going on and why is the connection not made? This is where research translation comes into play, where we can actually apply that new technology safely and appropriately, those new innovations, implement those practice changes. So to give a little bit of history, if we look back at the Institute of Medicine in 2000, they put out a publication called To Err is Human. In this publication, they highlighted preventable medical error. They spoke to, in terms of how to address medical error, and highlighted the fact that prevention requires system-wide changes. In 2001, they followed To Err is Human with Crossing the Quality Chasm, in which they called for a major overhaul of the healthcare delivery system. And they suggested that this be done by some very specific methods. One, they wanted to encourage focus on 6 aims for improvement. That healthcare should be safe, it should be effective, it should be patient-centered, it should be timely, it should be efficient, and it should be equitable. Again, notice that equitable as far as healthcare equity. And they also encouraged research translation, translating evidence into practice. And in this context, they wanted more so these aims to be translated into practice. They also suggested 10 rules for redesign, which can be used as guiding principles. They also talked about changing the healthcare environment through the use of evidence-based practice, through the use of information technology, through the use of aligning payment with QI. And we see that in many instances where if you have a certain percentage of diabetics with the A1C less than 9, that impacts some of your reimbursement. And they also spoke to workforce preparation, and not just nursing, not just medicine, not just some of the core disciplines that you think of, but they spoke to workforce development and preparation across the spectrum. They talked about quality and safety emphasis and focus throughout programs ranging from respiratory therapists to nurses to medical doctors. And so looking at kind of a system-wide workforce development. In 2003, they followed with the Bridge to Quality, kind of piggybacking off of that workforce preparation piece, in which they focused on the core competencies that healthcare providers need in order to do all of the things that they've talked about doing, in order to prevent medical error, in order to focus on aims that improve care, to redesign the system, and to change the environment. In order to achieve these aims, you have to have a healthcare provider with a particular set of skills. And so they were recommending at that time that healthcare providers be educated to deliver patient-centered care as members of an interdisciplinary team, that there's emphasis on evidence-based practice, quality improvement approaches, and informatics. So again, the complex healthcare system, we need new tools and skill sets. The IOM encouraged to foster innovation to improve the delivery of care. And you had the Institute of Medicine, the Joint Commission, Robert Wood Johnson said we really need to better educate and prepare our healthcare professionals. You also had the National Academy of Sciences and American Association of Colleges of Nurses, who encouraged the preparation of expert practitioners. An expert doesn't necessarily mean that you have more knowledge in pathophysiology, more knowledge in pharmacology, more knowledge in physical assessment. That's not what it was speaking to. It was speaking to a wider range of skill set to address these complexities. And in the backdrop, you also had the notion that amongst advanced practice nurses, like other disciplines, such as physical therapy, that have practiced doctorates, that perhaps the nursing profession should have those practice doctorates too. So just to kind of recap and put it in a different format for those who process things differently, like myself. So when you're looking at it from a visual standpoint, you think about the rules for redesign. So you see the 10 rules here on the left-hand side. That care is based on continuous healing relationships. In other words, that patient has access to that provider through office visit appointments, through what we see now using information technology, where patients use the patient portal. That care is customized. It must be individualized based on patient needs and values. Patient is a source of control. Knowledge is shared. Decision making is evidence-based. So you see all of these different principles coming through. These are things that should guide our healthcare system. And you also see some of the core competencies, providing patient-centered care, and where those competencies manifest in terms of the healthcare system and the rules for redesign. Evidence-based practice, quality improvement, working in interdisciplinary teams, as well as utilizing informatics. Where can those things present themselves, and how can they benefit the healthcare system and address the needs within the healthcare system? So again, overlap of core competencies. Same principle, different picture. We process differently. So what does that do for a DNP prepared nurse? That gives us opportunity to utilize, again, a very unique skill set. And so understand that as a DNP prepared nurse, that is a certain level of distinction. You are and will be distinct from your MSN counterparts. You certainly will work hand in hand, and you certainly will see some of these skills and competencies in your MSN counterparts. However, it's important to note, or you're in this program so that you specifically have a foundation and develop these skills and have an opportunity to practice these skills. So the DNP prepared, or the DNP degree, when we say DNP, we're not talking about a person, we're talking about a degree. But it does prepare advanced practice nurses to meet the needs of the complex healthcare system. Why? Because we're improving systems of care through research translation that promotes positive population health outcomes. And this says translation, translating. It should say research translation. Translating should not be there. But that promotes positive population health outcomes. And so how are we doing this? This is why DNP essentials are so important. And this is why you all are doing the competency assessment to see where am I with these essentials and where do I need to grow. Your experience and what you do in practicum when you drive and determine it, you should be looking at where am I okay and where do I need to develop professionally. So here are the 8 essentials. Scientific underpinnings for practice. Is what you're doing based on evidence? Is it based on literature? Is what I'm explaining in terms of even my problem? What's the scientific underpinning? What is the scientific underpinning for my intervention? What is the scientific underpinning for my theory? As you read, and you'll see in the bottom, anytime it relates to something in your text or reading assignment that you've been given, please refer to that for more detail. So again, scientific underpinnings. Where's the evidence behind what you're doing? Organizational leadership and systems leadership for QI and systems thinking. In terms of developing, how am I going to lead within an organization? And leadership doesn't always relate to title and position. And how am I going to lead a system? How am I going to change that system? And looking at the perspective of leadership from the standpoint of quality improvement and from the standpoint of systems thinking. That's very, very important. And so clinical scholarship and analytical methods for evidence-based practice. We'll talk a little bit more about clinical scholarship and what that means, but the analytical methods for evidence-based practice goes back to, how you analyze and critique even the literature and the evidence that you're looking at to ground your practice, to ground your understanding of a particular problem in a population. This goes back to your critical appraisals. And it also goes back to you looking at, as you develop your project and being able to determine and analyze how you need to plan in terms of being able to appropriately evaluate or identify outcomes and evaluate those outcomes appropriately and design your study according to your study aims so that everything is in alignment. You've also got the information systems technology and patient care technology. It's important to recognize the role of IT in your project and where you utilize it, how you utilize it, and how you can maximize its use. Healthcare policy, looking at where changes need to be made in policy. This could be policy as it relates to policy within the organization. It could be policy within the system that may affect multiple sites. It could be a policy at a city, state, a federal level, but looking at the various policies that impact care. Interprofessional collaboration, collaborating with the persons at the site for the point of improving patient population health outcomes. Part of your SWOT analysis entails that collaboration. Clinical prevention and population health, looking at it from the standpoint, again, that goes back to your population problem, defining that, understanding that. That goes back to your intervention, because that, to some extent, your practice change may include an element of clinical prevention, and obviously includes an element of population health, because that is the outcome that you are looking to impact. As a DNP prepared nurse, it's not just about a practice change, but it is a practice change that is focused on a positive population health outcome. And then also advanced nursing practice. And that is the element, obviously, of being a family nurse practitioner, but for our program, being that advanced practice nurse, but understanding your role as it relates to how that advanced practice nurse addresses various problems within patient and population. And so, again, the text reading that you need to refer to is at the bottom of the page. But here's a comparison of the IOM's recommendations for healthcare improvement, looking at the competencies and then looking at doctoral preparation. So you see the aim, you see the competency, and you see the alignment with the essentials. So even as you go through and do your competency assessment and you begin to formulate the goals or the objectives that you're going to be working towards, look at what you're going to be achieving in this course in terms of putting together your project and planning its implementation. And so as you're doing that, consider where these essentials fall into place and what you're going to be putting together to achieve those essentials, or to demonstrate competency with those competencies that correspond to each essential. And that's something that should actually occur in your mind as you're going through, and is actually a good way to distinguish and tease out, when you are in clinic, which hours are, particularly for those that may be still in the nurse practitioner program, the BSN and DNP students, so that you have an opportunity to see, am I focused on this one patient, or is this particular component more population focused and in line with one of the essentials? That's a good way to figure out how you're allocating your time, particularly if you're doing residency and research translation at the same site. Again, this is a continuation that shows the aims, the core competencies, and the DNP essentials, how they go together. And this takes you through all of them. Okay, so the various competencies that I mentioned, the aims, where do we focus on these? So this is kind of a crosswalk, if you would say, of each essential, and where in the curriculum that you're currently in, you get elements of these various essentials. You have opportunity to build, to develop, to lay foundation, build and develop, and grow your skill set as it relates to these essentials. And you can see that our course 7302 provides opportunity for every essential. The only essential that is not there is essential 4, which, if I'm not mistaken, yeah, it's information technology. And for those persons that have projects that entail information technology, then you're still afforded that opportunity in this course. But for those that don't, it's not something that we emphasize, but you will get elements of it in other courses. And so the essentials are there so that you develop competencies. once you develop those competencies and have that skill set, the aim is to implement practice change that is going to change a system and improve population health. So what is research translation? So it's translating research or evidence into routine practice. That word routine is very key, because even the practice change that you're working to implement, one of the things that we will focus on a little bit later in the semester is, how do we sustain this? How do we keep this going? What do we need to do now to ensure that this remains in place later? And so research translation itself still remains a major challenge in the healthcare system. In 2001, in Crossing the Quality Chasm, they used to say that it took more than 17 years to bridge the research to practice gap. I would have to find some new evidence or new literature or whatnot to tell you what that research to practice gap currently is. I'd like to think that it was shorter. And some of the reasons why I'd like to think it is shorter is because simply just information technology. But just because the information is there doesn't mean that it always gets translated into practice. They can update a guideline tomorrow, and you still have some people that may not recognize that it's there, realize that it's there, start implementing it for several months. And so when you look at translation of research, you ask the question, why can't we just do it? It's not always as easy as you think it is. And so you have to think about the 3 stages. As I just mentioned, being aware of the evidence, accepting the evidence, because some people may not, and then adopting. And what happens is that even if we know the guidelines were recently revised, and we accept that, and we change a policy and we give it to everybody, there may not be the emphasis and attention focused on the adoption process. And so that's where research translation is very key. Research translation bridges that gap between science or literature, evidence, practice, research, whichever term you choose to use, and practice. So it addresses the disconnect. So what is adoption? Adoption is when knowledge becomes part of the clinician's routine procedures and practice, and it is the use of appropriate implementation strategies. The thing about it is that implementation strategies are very important. They will make or break. And so research translation in that regard is a science that requires strategy to implement research or evidence in practice. Think about someone that you want to ask a favor of, or you need to get them to do something for you. Let's just say I want to get my husband to take me somewhere, or whatever it is I need him to do around the house that I asked 6 months ago or something like that. So it may come a point in time where I'm like, okay, so if I need to do, how am I going to get him to do this? If I do ABC or if I say something and then do ABC, maybe he'll do it. I have to figure out what is the science to getting him to be aware, accept, and adopt. What is that science that is important? And so adopting new knowledge, identifying what are the implementation strategies, what are the barriers. I have to consider the target setting or environment, and I have to evaluate, how am I going to do this? So you take all of those things into consideration. Again, keeping in mind that the aim of research translation is to implement successfully, implement fully, and incorporate it and have it adopted into routine practice so that population health is improved and that you are promoting quality and safety. So how do we do that? This is a recap from research and evidence-based practice. You're asking a practice question. You're looking at the evidence as it relates to that problem that you've identified so that you have a full understanding. You're also looking at the evidence regarding solutions and identifying the innovation or the practice change that is going to work well in your setting, and then you translate. So the translation again is determining the appropriateness and feasibility of recommendations for into a specific practice setting. It's creating an action plan, implementing those changes, evaluating those changes, and then reporting the findings. In research and evidence-based practice, the emphasis was on developing the question and defining the scope of the problem, and searching the evidence for practice recommendations, which you critiqued, you summarized, and determined the overall strength. And so now we're at the point, we ended research and evidence-based practice at a point of looking at appropriateness and feasibility. And so now we're at the point of moving forward with, okay, we're going to wrap up these former stages and begin to plan. And again, just to revisit the evidence-based practice process, cultivating the spirit of inquiry, asking the burning questions, searching for the best evidence, appraising that evidence. Now we're at the point where we need to integrate the evidence and evaluate the outcomes and disseminate the outcomes. And so this involves a good deal of planning of how we're going to integrate, how we're going to evaluate, and also speaking a little to how we're going to disseminate. So what's the point of the DNP project? The DNP project, again, gives you that opportunity to lay a foundation to put those skills and those competencies from the DNP essentials into practice, for you to practice the essentials through your DNP project, and for you to make a practice change and go through this process so that you are competent to do this when you graduate and get into actual practice. This is what makes the DNP prepared nurse different. And so the DNP project is a tangible and deliverable academic product that's derived from practice immersion. It's a final project, will be when you get to graduation, that shows the outcomes of your education, and it provides a means for you to be evaluated, and it demonstrates your growth in knowledge and expertise. It also serves as a foundation for future scholarly practice. So your DNP project gives you an opportunity to focus on system leadership, to focus on process improvement, to translate evidence, all with the aim of improving care. Essentially, in your own DNP project, you will bridge a gap. You will address this chasm that exists between research, that exists between evidence and practice. And you will bridge that gap with a practice change, an innovative practice change. And so when you start talking about, well, what does it mean to lay the foundation for future scholarly practice? The topics that were chosen for your DNP project, as discussed, should be of significant interest to you, because one, you will spend a good deal of time engaged with it, but it's laying the foundation for, once you graduate and get into practice, how you're going to continue to function and as a DNP prepared nurse, demonstrating the DNP essentials. And so that comes in the form of what we call practice scholarship. As you move forward, you will define and solve healthcare problems. You'll apply nursing and related knowledge to assessment and validation of patient care outcomes, measuring quality indicators, refining practice protocols, evaluating systems of care, and analyzing healthcare delivery models. This is practice scholarship that is it's different than what MSN students will come out expecting to have a skill set. And so some of the practice scholarship components, obviously, the development of clinical knowledge in terms of researching and evaluating studies, professional development, again, going back to those competencies in DNP essentials, testing new practice strategies, developing new models, that's application of your skills. And then service, taking some type of leadership roles in the practice that you're in, but also being a part of professional associations or organizations. This is all scholarly practice after you complete your degree, and that will emerge from the DNP essentials that you have developed. And so the proposal obviously is the proposal of what you're going to do in your project. You're going to go over these sections, which 1 through 7 will be what is focused on this semester. In hindsight, consider the fact that last semester you were focusing on the background and significance, learning about the problem. You semi-developed your purpose statement that should evolve a little bit. And you looked at laid the foundation for an evidence-based practice or a practice change, a quality improvement evidence-based practice intervention that you will implement as your practice change. And you also consider the theoretical framework. You also thought about what theory is applicable to the patient problem and the intervention and the context that I am addressing. And so those components are part of the first assignment because it gives you an opportunity to recap, to go back and look at the feedback you received on your literature review assignment so that you can incorporate that into what you submit. And this is an opportunity to enhance what was submitted as your lit review and to also give additional focus, particularly on the quality improvement evidence-based practice intervention section, and adding some more meat to the evidence that supports it. In research and evidence-based practice, you looked at, I think I suggested at least 3 different interventions to determine which one is the best fit. And so now you're just going to focus on that one and further develop it. And so after that portion is completed, we'll spend the middle portion of the semester focusing on methodology. And then we will spend the latter portion of the semester with implementation and anticipated limitations. As you move forward from this class and actually implement your project, obviously that's when you'll move on in other courses with results, conclusions, references. You'll have those throughout your literature matrix. You should already have some done from your matrix assignment. Continue to matrix those articles that are part of your study. It's very important. That helps you familiarize yourself with the literature as well as your appendices. So at the end of the day, why hire a DNP prepared nurse? When you look at the value, and not just the value, but that value translates to impact of having the practice doctorate. So you're going to have advanced nursing knowledge, and that goes back to your DNP skill set. That goes back to your DNP essentials. Having that knowledge and that skill set positions you to generate practice changes, generate practice change based on evidence. And these are innovative practice changes. And so it gives you an opportunity also to be in innovative advanced practice roles. And so you may have more responsibilities than being in clinic and solely seeing patients. You may be more engaged on an administrative level if you position and market yourself as such. And what is the point? Again, what is the DNP prepared nurse doing? They are addressing population health outcomes that in turn are going to impact individual patients. Changing the system, addressing policy, focused on outcomes. DNP prepared nurses make a difference in the healthcare system as it relates to population health outcomes. And that is where the value is, and that is the added impact of having the practice doctorate And so that concludes this presentation.